Hi, my name is Julia Payne. I am a nurse practitioner student. I'm just coming in to talk with you and your family about your new diagnosis that you're receiving, kind of the pathophysiology and what to expect with it. So, the diagnosis that you have is fibromyalgia. What fibromyalgia is it is widespread pain and tenderness in localized areas. It's it's not known what the pathophysiology of fibromyalgia really is. We're still trying to figure that out and figure out kind of what's going on with it, but we do know a lot of key mechanisms that go along with it. So what we see with it is central sensitization. Um, and what that means is you're going to have increased pain due to the changes in your central nervous system. For some reason, something triggered it, and your central nervous system has increased levels of certain chemicals in the brain and that in the brain that signals pain. And with that, it heightens your pain senses, and then it also lowers the threshold of pain that you're going to see with that. And so that's usually what leads to the localized pain. You also have altered pain processes. So what you'll see is in the brain and in the spinal cord, the processing that usually processes pain and sends those signals to your brain and lets your brain know we're experiencing pain is often heightened. And so a lot of the times it's sending to your brain constantly of like, oh, there's pain, which is why it's that constant pain. And so again, you'll see that lower threshold for pain, and you'll kind of notice that more often. We do believe that fibromyalgia does have a genetic factor to it, and so a lot of the times what happens is you'll have this genetic dispensation for it, and then you'll have triggering events that will just switch your body into increase that central sensitization and then alter that pain processing. Some of those trigger factorings can include physical trauma, surgery, infection, or significant physiological stress, psychological stress, excuse me, which can lead to the onset of your fibromyalgia. Some symptoms you're going to see is what we talked about, that widespread pain where it's just constant dull aching all over your body. To have the diagnosis, it does have to last longer than 3 months, and it has to be on both sides of the body and above the waist and below the waist. You will see a lot of fatigue just because fibromyalgia does alter the deep sleep stages as you are sleeping at nighttime. With that pain, it's just really hard for the body to completely relax and get into that deep sleep, and so you'll often feel that fatigue, and then you'll have cognitive difficulties. So this is often referred as the fibro fog, and this includes problems with focus, attention, and memory. And then other symptoms we're going to see is you can have headaches, you can have depression, you can have irritable bowel syndrome, and then temporomandibular joint disorders, so TMJ, so a lot of time just pain in your jaw right here. The outcome for fibromyalgia, it is something that we can never completely treat and have go away. It's something that you will always deal with through your life, but we can treat the pain and treat the symptoms that come along with fibromyalgia. So it is able to, through pain medication and through physical therapy and through all of these other things, we can get your pain to decrease, and by decreasing your pain will help your sleep and help your cognitive difficulties as well. A lot of people have seen that with pain management, they have long periods of remission and usually do really well. There is not a specific lab or tests that is done with fibromyalgia. Usually it's just a medical history, which we did with you already. We sat down and took your medical history, and we did a physical examination, and we found that you have tenderness in specific areas of the body. To have fibromyalgia, to actually have the diagnosis, you have to have widespread pain that lasts for at least that 3 months. And it has to be present in at least 4 or 5 regions. So whether that is the left the left upper body, the right upper body, the right lower, the axial, meaning your neck, your back, your chest, or your abdomen. Fibromyalgia can sometimes go along with other conditions, so we do want to make sure we did your full workup. So we got your CBC, you got your ESR, thyroid function tests, rheumatoid factor, and then the ANA test. And so we just wanted to double check and make sure that there wasn't anything else going on. But we did end up getting to the diagnosis of fibromyalgia. With fibromyalgia, one thing that we do want to caution is opioids are not actually our first line of treatment for fibromyalgia, because this is a constant treatment, something that you're going to be dealing with long term. It's not something we want to give you if we can avoid it. So we're going to try a lot of other things. But if we do come to that point where we do need to treat you with opioids, we'll just want to make sure we give you a good education that goes along with it. We'll just be monitoring you regularly and just doing a lot of following up and education on naloxone and how to take it properly. So we're excited to be able to take you through this journey, and hopefully we can treat those symptoms and get you feeling better.